Hi everybody, this is Dr. VASAN, cosmetic plastic surgeon from Chennai Hair Transplant Center and VASAN Hair Care Clinic. I am going to brief you about hair transplantation. Something new, the suction technique in hair transplantation. Around 70 to 80% of the reason for the baldness we can relate it to the androgenic alopecia, that means the male pattern baldness, where due to the hormonal problems, the testosterone hormone, the derivative of the testosterone, the DST, what we call it as, when the hormonal level keeps on rising, they tend to lose hair in the head. Remaining 20% of the time, either it can be due to the stress or any dandruff, fungal infection, drug intakes, various drugs intakes, or using salt water, or any pathological disease of the scalp. There are so many factors are there in this remaining 20%. But most of the time, it's due to the hormonal problems. Hair transplantation by suction method. What's new in this? As we are hair transplant surgeons, we are doing this for nearly a decade, and I am there in this field for past 5 years. We have done a quite good number of hair transplantation now. And most of the time, we come across the side effects which commonly spoke about was, one was swelling over the forehead after the transplant. But anyway, it goes in a couple of days. But other side effects like cyst formation, that means like a pimples in the forehead after the transplant. The cyst formation, which is the one which is quite disturbing me for a very long time. It comes few days after the transplant, here and there small pimples like. Anyway, it takes 4 to 5 months of time to go back and come back to the normal level. But still that 4 to 5 months time, the clients keep on asking repeatedly about the treatment for this. So first of all, I would like to find out what was the reason for the cyst formation. As some of us surgeons, we are using the needles like 18 gauge, 20 gauge, or even the 19 gauge needle, where what happens is, while you are pricking it, that amount of skin debris which is collected inside that needle hole, which goes inside that hole and stays there. Over that, we are putting this graft. So what happens is, this skin debris which forms a cyst at a later date. So then I introduced this suction technique, where that needle is connected to a suction. So while pricking into the scalp area, the skin debris which gets sucked out. So there is no skin debris inside to form the cyst formation. So mainly I introduced this suction technique only for this clearing of the cyst formation. Then later date, it had many other advantages, like fast of inserting the graft has been increased. One, that skin debris comes out, that is one advantage. The second advantage was it controls the bleeding. So field of vision is totally clear there. Third thing is, it guides the graft properly inside the hole. So 3 advantages came across for finding out the solution for one. So that's why I use this technique. Outcome mainly depends upon the density of the follicular units, what we are keeping it. And if it is more than 60 to 80 follicular units in per square centimeter area, the outcome will be very good. And it depends upon the thickness of the graft. And third thing, it also depends upon the nature of the hair. If it is curly hair, result will be better. And if that person is not having any medical contraindications or any scarring disorders, or any like scarring disorders like keloid or something like that, outcome will be better. Having said that, we take utmost care in our center to overcome all those problems, and hence we are there here to produce good results here. Thank you.